if somebody is starting today, somebody is looking forward to start a business in healthcare, digital healthcare, and they want to start building their product, what advice would you give them?
I mean, I think the big problem for anyone is they don't know what they don't know, and that was certainly the case with me. This is the third company I've done, and so I would suggest that the important things early on are to learn from mentors, to learn from other groups of people, and to not try and not take the approach of hoping to build the perfect tool. And expecting people to come to you. I think you need to have an MVP. I don't think nowadays you can just have a pure fantasy idea. I think in the last 2 or 3 years the business side has changed and they expect to see something now. But I don't think you have to build perfection straight off. But you do need to have some sort of tool that operates and that can be demonstrated to be helpful.
Welcome to the Convergence Play podcast.
So thank you so much. I think let's get started. And of course, you have a very impressive experience working in healthcare. So I think a good starting point will be to know a little bit about your journey. And definitely, if we can connect that journey with your vision behind Async Health, I think that would be a great starting point.
So I've got a long journey in terms of developing the company Async Health. I first really got interested in technology when I was working in Australia back in about 1990. And I had taken a job in the center of the outback in a place called Broken Hill that many people have not heard about. But I was the only psychiatrist working for the whole region of Central Australia. And the landmass that I was responsible for was actually about the same geographic size as California. But only contained about 35,000 people. And of those 35,000 people, many were farmers or ranchers living in very isolated areas, and many were Aboriginal populations. So as the only psychiatrist for that region, I used to actually drive long distances. I also used to fly with the Royal Flying Doctor Service. Yeah, so I used to travel hundreds of miles to do clinics, either driving or flying. And it was very inefficient. And I spent a lot of time traveling just to see a few people. Of course, it was also difficult when the only way people could contact me was on the phone or via radio. Because it was hard to deliver services like that and help people who were perhaps suicidal or had a substance use problem, often alcohol in the outback. So I got very interested in technology as a possible tool. So this was the time when actually email was just coming in internationally in the early 1990s. So was video conferencing. So I essentially got a large grant, over $500,000 from the Australian government to buy 2 video conferencing setups. And I set them up in 2 different areas down in South Australia and started using video to see obviously the patient still had to travel to a video connection, but they didn't have to travel as far. And so I found that quite effective. What was really useful is that the patients loved it. The patients were very positive about seeing me on video. And I actually remember the first ever patient I saw was an Aboriginal woman who had depression. We had a good conversation about her depression. I talked to her about the different treatment approaches. And at the end, she said to me that she'd really enjoyed the session and asked me if I'd recorded it. And I said, no, I hadn't, because the lawyers had told us not to record the video. And so I was a bit surprised by that question. I asked her, well, why do you say that? Why are you interested in whether I recorded it or not? And she said, well, actually, she wanted to have a recording if possible, because she'd like to show it to all the other members of her community. Because first of all, she'd never been on TV before. And secondly, she thought it was a really good way to see the doctor. So that was actually my first ever consult. And ever since then, I have really got more and more involved in the use of technology to provide better access to care in mental health in particular. As I'm sure you know, there's a huge problem with access to mental health providers around the world. And so I've been now working in this field, both clinically and from a research perspective, for over 30 years. Now, so as I say, I started using video to see patients back in the early 1990s. I've seen thousands of patients since then. But if we fast forward to now 2009, by then I'd moved to America. I was recruited by the University of California to run the health informatics program at UC Davis. And I still continued to see patients. So one of the patients I was seeing back in 2009 was a very nice lady in her 70s who had a bipolar disorder. She and her husband used to spend 6 months of a year in another state where it was sunnier and warmer. And so they used to go to this other state. And in 2009, when they went there, she became depressed. I was the only psychiatrist she had. And this was about a year or so after iPhones had been introduced. And her husband was very techie. And so he sat her down and actually said to her that he was going to take a video of her, and he wanted her to speak to me as if she was seeing me in a consultation and tell me all about her symptoms and the difficulties she was having with her depression. So he recorded this about a 5-minute video. And then he sent it to me, and I looked at it, was able to see that, her bipolar disorder had obviously got worse. She was more depressed. And so I went on our electronic medical record system. I changed her meds, sent her a new prescription in the other state. She was able to start that prescription, and within a couple of weeks, she was feeling very much better. So that was my introduction to asynchronous consultations. In other words, a consultation where a video of the patient is taken and sent to an expert for analysis and action. And it just had always seemed to me very strange that we never recorded videos of patients when we were seeing them using traditional telepsychiatry. And here was a great example of how I could do a consultation recording the patient and then change their treatment and help them. So ever since then, I've been really doing a lot of research on asynchronous telepsychiatry or asynchronous consultations. And essentially what we've been doing in that time is using video as data. Most people, when they think about data, they think about text or numbers
Videos.
or audio. They don't think of video as being the actual data that they're collecting. And so I spent the next 10 or 12 years researching asynchronous consultations at UC Davis. I had about $7 million worth of money from the National Institutes of Health for research. And we proved that these asynchronous consultations were reliable, were as diagnostically as good as ordinary consultations, and were administratively simple. And very importantly, that patients really liked them and found them more convenient. And we did these consultations across 3 clinical trials. So during that time, we essentially proved that it was possible to do these asynchronous consultations, that as I say, the patients liked them. They were as reliable diagnostically as other consultations, and that they were administratively simpler and somewhat cheaper. And we published about 15 papers across 3 clinical trials. And that really led us to about 2022. And at that stage in my career, I decided I could either continue doing this work in a university setting and demonstrate the evidence and improve the evidence base for the use of essentially video as data in mental health, or I could set up a company and try and really create a company to do this in the commercial world. And so that's what I did. So in 2022, we set up Async Health, and the aim there was to essentially spread the use of asynchronous video consultations, whereby we captured video of patients and then transcribed that video so that we had a lot of the documentation pre-written for the psychiatrist or other expert. But given the fact that AI had moved forward a great deal by 2022, we decided that we would obviously rewrite all the software we'd previously built at UC Davis. And so we rewrote it completely from scratch and we've implemented a lot of AI in our current software. So the software as it's being used now with patients consists of an AI video agent who actually interviews the patient. Now, this is a non-agentic interview, so we don't let the AI interviewer go off and ask all sorts of strange questions and potentially are liable for hallucinatory questions. We predefine and customize question sets for different types of patients. And we can obviously divert the conversation using decision tree technology, so that if a patient starts talking about suicide, we can then ask a number of questions about suicide and then go back to the main question set. So essentially, we capture a recording of the patient's history as they answer all the questions from the video agent. We then take that recording and we use ambient AI to actually write a transcript of a recording, then to do a summary of the actual conversation, and finally to write the medical notes. And so we can write any sort of template, using any sort of template we want with the AI systems we have. And so we essentially write a first draft of a medical notes for the physician or other mental health provider who's going to see the patient. Now, because we're capturing video, we can also do other things, of course. We can use facial and voice recognition, tone recognition, a whole series of other tools, so that when the physician goes in to do their assessment of the patient who's gone through this process, they actually have more information available to them than they would in a normal in-person interview. So currently we have a mood score that looks at using facial recognition technology. And we also have another component that picks up any words that appear dangerous and identifies them and gives a rapid summary of any sort of dangerousness perspectives for the clinician who's reviewing all of this data on their dashboard. So ultimately, what we've created so far is really a much more efficient way of seeing patients for their initial consultations and for their follow-up. We're not trying to do therapy at all. We're doing assessments and medication management primarily. But we're using AI, I think, in a careful, sensible way, without getting into any sort of big risks about some of the downsides of AI, particularly the hallucinations. And because we collect video of the patients, we can easily check exactly what the patient has said. So if there's something odd that comes up in the transcript that might be a hallucination, we can actually link straight back to the video and see what the patient actually said and correct the transcript. So we don't have the risks that a lot of the other chatbots have when they're seeing patients. And I think that's very important. We're a clinically sound company, and we're very careful to make sure that the clinician is always in charge. So the clinician has to sign off on any of our consultations. And essentially what we've developed is a very, very smart decision support tool.
Thank you. Thank you for the introduction, for background, and it's really impressive your experience. And I think you started using videos in the um, last 20 or 30 years. So, and then you have been using it. So it says a lot about your authentic experience of what you are trying to build now. So it's authentic experience from many decades, I would say. And of course, I think one of the smartest move which probably you did is rewriting everything using latest AI, because I think of a lot of founders, if they have something in work and it's already serving its purpose, they are very much afraid to change it or upgrade the technology stack. So I think the greatest thing you did is upgrading it using latest AI. And of course, as you were mentioning, now the possibilities are endless. I think you can use sentiment analysis as well to further improve recommendation and further improve the systems. So that's thank you for the great introduction. I took a couple of mental notes I would like to ask you. So is this system integratable with other entities as well? For example, EMRs and other healthcare solutions or applications that are commonly used in clinics. Is this integratable with those, or how does this work?
So, well, first of all, thanks for your comments about the decision to rebuild the software. And that was a very big decision because we had already created the company and we'd run the company for about 6 or 9 months before we made that decision to literally throw out all the software we'd developed previously and start again. And sometimes you have to do that. But the essentially, in terms of integration with other technologies, I mean, we are fully HIPAA compliant. We're almost SOC 2 compliant now. So we can write APIs and we can quite easily interact with other technologies. And certainly I would expect that we will be integrated fully with a whole series of electronic medical record systems in particular. At the moment, what the clinician does is literally we have a system whereby they can write their notes in our software, and then with a single click, they can create a PDF and convert all of their notes. They essentially cut and paste their notes and put them straight into their EMR. Now, obviously, I'd much rather that our notes went straight into another EMR, and we've actually done a big project with Epic through UC Davis to look at how could we get our software integrated fully with Epic, which is the sort of most highly used EMR in this country at the current time, and that won't be a major problem. So what we're really doing strategically is we've now got a number of customers in our pipeline and that we're already working with. And we're looking at essentially starting to integrate our software with whatever EMRs they're using, rather than trying to just pick some particular EMRs and go with that. So eventually, I think we'll be integrated with multiple different EMRs. But as you well know, there are literally hundreds of EMRs in use in America at the moment, never mind around the world. And so it's impossible to try and integrate with all of them.
So do you also have plan to expand the radius of async health outside of US as well, other regions, other areas?
No doubt about that at all. I mean, we're a software company. We're not providing the services. So our customers actually provide the clinical services and we sell them the software to use. And we train their clinicians as to how to use the software. And it's very simple. It's basically a YouTube-like interface. So if you've used YouTube, you can use our software. So yeah, we've had discussions actually in multiple other countries already. I mean, in Britain with groups of companies that are working with the National Health Service, in India with several groups over in India, and also in Australia. Australia's got a very substantial national sort of digital health policy process going at the moment. And so we're actually part of bids from a couple of companies over in Australia to implement our software there. So I think we've got options, in many different countries, and it's a very exciting time.
Absolutely. Based on a lot of people we talk to, there are few other areas of the world that are picking up very fast in terms of advancing their healthcare, and one big region is Middle East, especially UAE. They're doing some amazing stuff in improving digital solutions, and likewise in a lot of parts of Africa, there is the adoption is started for EMRs and solutions like the one you have. So I think those are also very interesting geographies to be getting started, and I think solutions like this will have a great place in their ecosystem.
I agree entirely. I mean, in fact, we haven't had direct conversations with companies from those countries, but we have had quite a number of conversations with a British company that actually provides psychiatric assessments to Dubai and to UAE, so we may well get into those countries sort of on the back of another company from Britain, but we'll see.
Absolutely. Sounds great. So how does this application you have, as far as I am understanding, you are in B2B business model, right? So your clients are actually clinics, or you are also in B2C area.
No, we're really in B2B. So our clients are primarily, clinics or hospital systems, universities, and of course, smaller private practice clinics, either for psychiatrists or therapists, psychologists. But essentially, we're selling very much B2B.
Sounds good. So I'm assuming that it's a software as a service model. So clinics or your end user, they don't have to install or set up anything on their end. They just have to sign up for a subscription, and they can use it, and all the data will be stored in cloud in HIPAA compliance secure way. Is this correct?
That's absolutely correct. Yes. All of the process for this is actually available on our website. So is our pricing. And we charge on a price per clinician per month. And, we do all of if people need extra development or need to change the question set they want, which they often do, then we do that as part of the process. And it's a very straightforward approach. We actually don't allow people to download the videos. The videos, I don't want videos of patients floating around the internet, obviously, and from a HIPAA perspective. So we keep the videos, securely in a cloud storage system. But what people do download is the notes that are made from the videos that they use for their EMRs. And of course, as they have a contract with us, they can see the videos. They can go onto our system and see all the videos, but they just can't download the videos themselves.
Okay, okay, understood. So, Peter, if you have a you have a great product and a great passion for this. I want to understand the big picture in your mind. Let's say 3 years from now on, where you are looking ahead with respect to async health, where you want it to be.
So the big picture is, first of all, currently we're primarily in the mental health space. Now that's a big space anyway, with an enormous need. But in reality, our software can be used for any type of interviewing. It doesn't have to be mental health. And so there are multiple other areas in healthcare and in the education world in particular where our software could be used and where people can write their own custom data set, question sets, and then have the have our interviewers actually interviewing whoever it is they want to be interviewed, whether it be patients with a surgical problem or pre-anesthesia, or whether it be students wanting to get into college or university, or whatever. So there's a whole series of other use cases that we're exploring. We're actually in discussions with a couple of pharma companies at the moment about using this for clinical trials. Essentially, we've got a very effective data collection tool here, and that's what we've really developed. Now, and so I think that'll keep us nice and busy. In the long run, obviously, we're also collecting videos. And those videos ultimately will be available potentially to help us develop diagnostic and treatment algorithms for patients, and to train other AI systems. As I'm sure you know, there are very few data collections whereby AI is actually trained on videos, especially videos that have been validated by clinicians. In the long run, it may well be that we spin off another company that is essentially a data company that then can develop, the use of these videos more extensively.
Understood. Thank you. So, how big is your team right now in terms of your technical team or your engineering team? How big of a squad or group
There's
you
about
have?
We're small. We're at an early stages. We've got about a dozen people. Several of those are being paid. The majority are on equity, and they're spread across North America, Europe, and Asia. So we have people in all three continents already, and we're a virtual company with, we're very busy and very very hungry in many respects, and so because we have this already international platform, we have the ability to spread probably more rapidly than many other companies.
Good. And so that's great. I think having a global presence really gives some great perspective, especially when you are building product like this that you are hoping will be adopted not only in one area but many areas and many geographies. So I think every business, you know this more than anyone else. Every business has challenges. So, are there any challenges currently that you feel you need to resolve in order to maximize the potential of async health?
Sure. I mean, the obvious major challenge we have is the same as every other company that has started up, and that's getting funding. I spend half my time trying to raise funds, and the other half trying to, do business development and work with customers. If we could raise more money, and we've already raised over 600,000, but if we could raise more money more quickly, then we could do obviously a lot more than we're doing currently. We've made a strategic decision to uh, self-fund a lot of the company and to ensure that we maintain control of it. But obviously, we're still also looking for investors who would be interested in working with us, and allowing us to speed up our process.
So, do you have budget specified in terms of? I'm sure you will need some budget for the team growth. You may need some budget for tech innovations. So, do you have some sort of buckets defined in this regard with
Sure.
respect to your future?
Certainly. I mean, we're doing a seed round currently. We'd like to raise about 1.5 million. About half of that money would go on business development, and we need people to sell our product. We have a really good product that is functioning and is being used with patients right now. So we already have some revenue from that, but we need to sell our product more extensively and to follow up with our customers. So that's our major need right now is a combination of funding and putting that money into business development.
So, I think One final question from my side on technical aspects. Do you feel that your solution right now is scalable enough to handle, let's say, 5 time or 10 time more load than what it is currently running with?
Oh, there's no question about that. Yes, I mean we've had to go through this process, looking at how would we work in other countries, for instance, and we would just mirror our software. Australia is a good example. In Australia, they insist that any data that is collected in health actually is retained on Australian servers in Australia.
Understood.
And so, we would simply, put our software on servers there, and escalate the number of patients seen there. So we're very comfortable that we can handle a substantially increased amount of use.
So you are hosted on AWS or any other cloud at the moment?
Yeah,
What is it?
we're on a commercial cloud storage platform.
Reason I asked was that, of course, there are certain regions, for example, as we was talking about Middle East, where not all cloud service providers are available. And of course, there are also the similar regulations that you need to host data within that particular country's geographies. So there becomes the need for software applications to be cloud agnostic. They should be able to run on any cloud
Yeah.
as long as there is a server and an internet available on those.
Yes. Absolutely, I agree. And as I say, we've already had to investigate that fully for Australia, which is exactly the same as the countries you're describing in the Middle East. Yes, I mean, we expect that we'll have our software running on multiple different, server farms, as long as they're, fully compliant and secure with at least whatever is the local HIPAA regulation.
So, and I come to my final question, and that's my favorite one, and I think you will have a great answer for this. Uh, if somebody is starting today, somebody is looking forward to start a business in healthcare, digital healthcare, and they want to start building their product, what advice would you give them?
I mean, I think the big problem for anyone is they don't know what they don't know. And that was certainly the case with me. This is the third company I've done. We deliberately went and we've done 2 accelerator programs to learn more and be humble about what we think we know. And so I would suggest that, the important things early on are to learn from mentors, to learn from other groups of people, and to not try and not take the approach of hoping to build the perfect tool, and expecting people to come to you. I think you need to have an MVP. I don't think nowadays you can just have a pure fantasy idea. I think, in the last 2 or 3 years, the business side has changed, and they expect to see something now. But I don't think you have to build perfection straight off. But you do need to have some sort of tool that operates and that can be demonstrated to be helpful.
Thank you. Thank you so much. This is very powerful advice. And thank you so much for sharing your experience, your wisdom, and your vision for async health. Um, if you have any question for me, please feel free to let me know.
No, well, thank you very much, Ion. And I hope that if anybody's listening to this who's interested in investing with us or working with us in any way, they just come directly to me through our website. I'm very easy to find. And I look forward to speaking to people.
Yes, absolutely. And thank you so much. I really enjoyed our conversation. And we look forward to getting your story out in the public.
Thank you very much indeed. I appreciate it.
Thank you. Have a good day.